the severity of a lung lesion that is not a congenital diaphragmatic hernia, that is a sequestration or a cystic adenomatoid malformation, is basically correlated with the size of the lesion and the amount of cardiomediastinal shift. So very small masses almost never get into trouble unless they enlarge very, very rapidly over a short period of time, and that almost never happens. So you're pretty confident that if it's a very small lesion with very little shift of the heart, that it's going to be a very good prognosis. Medium-sized lesions, similarly, good prognosis. Where we start to worry about fetuses is when we have very, very large lesions that occupy most of the thorax and are so large that they push the heart and the other mediastinal structures over to the other side, and they invert the diaphragm, which is a very strong muscle. So you could imagine that in order for it to be flattened or even inverted, there has to be a lot of mass effect on that side of the thorax. That's how we determine the severity. Now, there are measurements that we use, sonographically obtained, that have been produced and suggested as good ways to follow fetuses, and we also measure these things. And those two measurements are the mass thoracic ratio, which we described a few years ago, and the CCAM volume ratio, which was described by the group in Philadelphia. We use both of those. They're sort of mathematical calculations based on the measurements of the mass and either related to the thorax or related to the gestational age. Either one of those are fairly useful, but truthfully, it's only the very large lesions among whom the fetuses would ever get into trouble, and then it's a small minority of those that would be threatening, because many of them, even the large ones, get smaller as gestation progresses.